Well, talking about all of those, like greens and testosterone, I remember we also mentioned about female fertility, and it's a very sensitive topic to all of us because we work a lot. We decided to become mothers in a very later stage of our lives. And probably the question would be, is it possible to somehow to prolong our fertility nowadays, or it's still something that we can't really cheat?
Okay, so if you talk about fertility, you have to remember what kind of tests we have to assess fertility. We have a test to assess quantity of your eggs, not quality. That's one thing is very important to remember. Physiologically, we were made to have babies the way we designed to have babies between ages of 15 and 35. Okay? That is the prime time. Of course, I'm not promoting teenage pregnancy, but what I'm saying is that's the way we are built. Okay? Although between 15 and 21, your hormonal levels are not set yet. So your ovulation could be sporadic here and there, and your pelvis in your anatomy is not complete yet. So that's why we are kind of like against teenage pregnancy. But theoretically, you are in the prime time. Why? Because you were born with a certain amount of eggs. You're born with certain amount of eggs, depends on your genetics. And you come with this basket of eggs to this world. And you have them in your ovaries in embryonic state. We call them germ cells. And then once you start ovulating in the age of 12, 15, whatever, you start dropping these eggs. And every time when you ovulate, you create the ovule, you create the follicle, you create the mature egg, you ovulate, egg is gone. You don't make eggs. You have what you have. Understand? Men, they make their sperm until they die. You just have to give them 72 hours. That's all they need. Okay? In 72 hours, if you completely empty him completely, in 72 hours, he's filled. He's good.
Wow.
He has enough. We have what we have. We have to remember that difference between our physiology. So the quantity of eggs is being tested by checking the blood test, two hormones, FSH and AMH, and there's a certain numbers. So there's a trick though. When you look at the parameters and ranges for 35-year-old, and if you look at the ranges, they say it's normal, it doesn't mean that you're fertile, because we know that physiologically the number of eggs is going down. So physiologically, your fertility is going down. And by the age of 35, it starts to, basically visibly go down on the scale when you look at it. And at the 40, it goes even lower and quicker. So that's one answer for your question. Quantity. But the quality, there's no test to assess quality. We don't have a test for that. Okay? So, and now we know that statistically, if the reproduction is going down by the age of 35, we're assuming that the quality of the eggs are going down as well, because after the age of 35, we also see correlation of other diseases like, Down syndrome, spina bifida, all these chromosomal abnormalities and aberration happen later in life when women have that. So you have to always keep that in mind. Now, today's society, we're all running businesses, working hard, building our careers. I totally get it. And it's very hard. And it's becoming like a little movement, well, not little, it's a big movement now to freeze your eggs and keep them. Which is, I say, if you don't have a partner, if you by yourself and there's no plans, then probably would be a good idea to do that if you can afford to do this. But if you have a partner, maybe it's a good idea to sit down with your partner and make a plan and do it as soon as possible. you know?
Mm-hmm.
So natural way is always the best way, always.
Mm-hmm.
So it's very touchy and very difficult, delicate area right now.
Mm-hmm.
All women are going through.
Yeah, that's true. Um, the natural way, you mean to just, like give a birth without doing IVF, right?
Yes, without IVF, yes.
Mm-hmm.
But if we have to go through IVF, you have to go through IVF. It's just you always try not to. You try to do it naturally and try to
Mm-hmm.
do it before age of 30.
Do you think
Um,
that for like the single women who go through egg freezing process, it's a hormonal stimulation, right? And I know like there is also like lots of fears about it. Should they be worried about this treatment, or like is it
yes,
safe?
well, I'm not gonna lie to you. There is a stimulation, and when you go to reproductive clinics, they're gonna say there is no evidence of risk, but we're gonna know about the evidence of the risk 20, 30, 40 years from now. These women who are massively getting stimulated, what are the patterns, if there is a risk or not? But just think about it. You are being bombarded with the high levels of hormones to stimulate your follicles. It is very stressful on your body. But again, you have to develop adaptability. If you need to go through this process, you have to develop adaptability of your body so you could recover faster. All comes to one thing: keep it in balance. Take care of
Yeah.
yourself, take your vitamins. It all goes to the same thing. Keep your body healthy, vibrant, and adaptable. That's the most important thing. It's not that survival of the fittest that happens, it's the more adapted one. The adaptation is the most important thing. That's the species that is going through evolution will survive.
Mm-hmm. Interesting. I also remember when during the event you gave a very great advice about like listening your body and
Yes,
understanding what your body tells you when, for example, we crave lots of sweets, like there is like some sort of deficiency, or like when we feel like angry, like during the period. Could you please like tell like once more time for like our listeners
sure,
like how to
sure.
recognize those signals?
So basically, cravings. If you're craving for salty foods, that means your adrenals are working, overworking. You're not getting enough sleep. Maybe you're stressing yourself too much. So you have to do something with your adrenals. If you're craving chocolate, it's magnesium deficiency. If you're craving sugar, there are two things. It's your adrenals because your cortisol is very high and your insulin is high, and that's why your body's trying to keep up with that and asking for more sugar. Second, it could be overgrowth of candida, okay, which microbiome is a completely different topic. We can talk about this for 3 hours. And the next thing is also you bleeding probably too much. Most of the time when they say they crave sugar, I ask them, do you pass clots when you bleed? People so used to bleeding clots and thinking that's normal, but clotting is actually, it's the body is trying to stop the bleeding. That means it's too much. You see? So it's a sign of being on the heavy side. Depends on the size of the clots. If the clot is less than a quarter, that is okay. It's tolerable, but it's still a sign. But if the clots are bigger than a quarter, that is a very, very strong sign that you need to do something, go and see a doctor. Yeah.
Mm-hmm.
So if you experiencing any kind of emotions, for example, if you become angry, like this angry frustration, that type of feelings, it's omega deficiency. If you're sad, if you want to just crawl under the table and just don't talk to anybody, it's vitamin D deficiency.
Mm-hmm.
And see? So yeah, listen to your body. Always listen to your body. Another thing
Mm-hmm.
also this is during your PMS time. But also remember, estrogen makes you motivated. Let's go, fast, feminine, like yourself.
Yeah.
Progesterone, oh, can we just go under the blanket, please? I don't want to do anything. And that's why we become fatter, we become more. So here's the thing though. cortisol and estrogen, they love together. Because you need cortisol. Cortisol gives you motivation. Cortisol gives you energy. So that's why you can complete all your tasks. If you have big projects and everything, try to fit that between day 1 of your bleeding and maybe day 10, day 12. You're going to be accomplishing everything. But if you have something big and it's coming between 10 and your 28-day cycle, then you remember you're probably going to need to take more breaks.
Interesting. Well, thank you so much.